This morning on BRN, preventative dental care for children and seniors. And we're going to welcome back to the program Dr. Mehta Sata. She is a spokesperson for the American Dental Association, and she's also a practicing dentist at the South Bay Children's Health Center. Dr. Sata, thanks so much for joining us again this morning.
No, I'm so excited to be here. Thank you for having me.
Yeah, and thanks for telling us about the Give Kids a Smile program. It sounds wonderful, and you always want to get off to a great start in your life, and obviously brushing your teeth, it's a great place to start in prevention. Let's talk about some of those prevention techniques. If I can't make it to Give Kids a Smile, and I've got children, what are my first steps? How do I help my child prevent tooth decay, periodontal disease, and other diseases down the line?
Absolutely. So obviously the goal, even with Give Kids a Smile, is to get children to a dental home where they're comfortable and they can be treated. But there's so much you can do. Most of the work is at home, and it's preventative. So brushing twice a day for 2 minutes a day. 2 minutes each time.
Mm-hmm.
Flossing at night so that you can get anything that's stuck in your teeth out. Rinsing with a mouthwash, preferably one that has fluoride in it, okay, because fluoride remineralizes the enamel. And, the main thing is diet, I would say. A lot of kids are eating a lot more processed foods these days and they're snacking. And so we want to make sure that they're drinking water and milk, avoid juices and, carbonated beverages that have sugar, and try to limit to 2 snacks a day. So 3 meals and 2 snacks. And obviously, processed foods, once in a while are okay, but many of them have hidden sugars. So you just want to watch processed foods.
And do I need to have, just as a follow-up, do I need to have special tools like, do I need to have a Barney Rubble Sonicare toothbrush, or can I just use a Barney Rubble traditional toothbrush? Barney Rubble from the Flintstones. That's what I had as a kid.
Absolutely know who Barney Rubble
That's
is.
what I had as a kid, and the Barney Rubble toothpaste. I'm not sure it was great toothpaste, but do you have to have special tools for your kid, or do the traditional toothbrushes and toothpastes work?
The traditional toothbrushes and toothpastes work. Okay, so you want to use a fluoridated toothpaste, and depending on if you're a child and you're not spitting, use very very little. Or you can use a training toothpaste, although it doesn't have fluoride in it. But once a child gets a little older, you'll use a pea-sized drop. And then as kids get older, or if you're an adult, you can use a little bit more toothpaste. But really, it doesn't take much. You could use any soft bristle toothbrush. But things like the Sonicare toothbrush that you mentioned or other electric toothbrushes do sometimes make it easier, especially if you have problems with dexterity. So some of my special needs patients find it easier to use a Sonicare or an electric toothbrush. Sometimes geriatric patients find it easier to use an electric toothbrush, but you still have to do the work of brushing all over your mouth and getting the right areas.
And how do I show my child how to brush their teeth? I mean, do I stand behind them? Do I stand next to them? Brush next to them? I guess like father, like son kind of thing. I mean, does that help for me to show my loved one how I do it, and therefore they kind of mimic what I do?
For sure. I'm a parent of 3 daughters, and I would say the best thing for any kind of behavior that you want to instill in them is to model it, right?
Yeah.
So, standing with them and brushing with them is a great idea. But also with kids, they don't have the dexterity and they can't get everywhere in their mouth. So, you do want to let them brush, but after they brush, you need to get in there as a parent and really hit all of those gum line areas. Kids are great at brushing the tops of their teeth, but when it comes to the sides, they often, they lack the patience and dexterity to get back there. So you do want to get in there. There are so many fun YouTube videos now that encourage kids to brush. So, if your child is a kid that has an iPad or a YouTube account or likes those things, then you can also just show them some fun videos.
Yeah, I guess they could watch Barney. I don't even know if Barney's still cool, but I think Barney was cool like 30 years ago, so maybe he's still cool. You could watch him. Oh, is it? So they've moved on. Or I was going to say the Teletubbies. If we could, Doctor, I want to switch gears. You know, we're the Broadcast Retirement Network, and obviously we have a whole range in our audience. But when you look at older people like me and seniors, are there special needs that we have to prevent future disease and to take care of what's in our mouth?
Well, first of all, you're not old. I think it's hilarious that you said that because I
Well,
am
I
your
mean, relative to some, I am though.
okay,
Relative to a
relative to
5-year-old,
some.
I'm old.
Yeah, you that's so funny. But yes, so the older we get, the more issues we have with things like gum recession and wear on our teeth. So things like making sure that you have a night guard if you're clenching, grinding, if you have a lot of dental work and you want it to last longer, I would say get a night guard. Most people I know our age should have a night guard. Obviously, prevention, all the same things that you expect from little ones, you would want to do yourself, brushing twice a day, flossing. Sometimes we have dental work in our mouth that requires some extra tools like those little proxy brushes that get in under crowns and bridges or implants. And as we age, your health, your overall health impacts your oral health and vice versa. So things like being on a medication, most medications have a side effect of what we call xerostomia, which is dry mouth. So you want to make sure that you're drinking lots of water and that if you truly have dry mouth, you're using special toothpaste, which you can get over the counter, and you are making sure that you know food that you're cleaning food out more often. So instead of brushing twice a day, you may want to brush more often so that instead of the saliva cleaning your mouth out, you're actually cleaning it out by rinsing or brushing.
And I guess last question. We talked in the last episode about going to the dentist every 6 months for an older person. And again, I guess it's maybe based on individual needs, but is it still the rule of thumb for a senior person, a mature person, to go every 6 months, or do you go even more if you have more calculus buildup or whatever?
Wow, you use the word calculus. That's
Right?
impressive.
Hey, look, I've been to the dentist numerous times and I have calculus buildup.
No, that was pretty impressive. Yeah,
Thank
so
you.
I like to encourage every 3 months for anybody that has any bone loss, just because it is the easiest way to keep your mouth healthy is to go in and get that calculus or tartar buildup, as the layman will call it, and get it off your teeth because that is just full of stuff that the bones and the gums don't like. So I do like encouraging going more often for those cleanings. As far as exams, x-rays, all of that, you don't need them that often, but again, it varies by your mouth. And
Yeah.
the important thing is once you get your mouth healthy is to try to keep it that way. So just going in routinely.
Yeah, absolutely. Well, no matter if you're young or mature, it's the gateway to everything. Look, it's the first entry point for food, and you got to take care of yourself. Dr. Sata, we're going to have to leave it there. Great program and Give Kids a Smile. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you. I appreciate it. Thank you for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.